You're watching TVC News, our featuring Sunday specials. Time now for our viewers on TVC News Nigeria and TVC Entertainment to join the live coverage of the events marking Lagos at 50 celebrations. But the Sunday specials continue on our international stream. Now, some weeks back, the World Health Organization announced another Ebola outbreak in the Democratic Republic of Congo. The international body has been trying hard to curtail the spread of the disease that has left about 4 people dead. In the Sunday special, health correspondent Oluwatoyin Abo finds out how prepared Nigeria is in preventing the outbreak of this deadly disease.
The Ebola virus got into Nigeria on the 20th July 2014 when an infected Liberian man arrived in Lagos, Africa's most populous city, by air transport. The man, who died in hospital 5 days later, set off a chain of transmission that infected 19 people, 7 of whom died. Then, health officials immediately repurposed technologies and infrastructure from World Health Organization and other partners to help identify cases and track potential chains of transmission of the Ebola virus. During this time, many schools, banks, restaurants and other corporate organizations had hand-washing bowls and sanitizers in their premises, and there was a sustained campaign of constant hand-washing. But after 20th October 2014, that the World Health Organization declared Nigeria free of Ebola, and commended the Nigerian government's sense of purpose in combating and defeating the deadly disease. Hand-washing soaps and sanitizers begin to disappear. People no longer practice hand-washing. And indeed, at the land borders and airports, officials no longer carry out the normal Ebola checks. Now there is an outbreak in the Democratic Republic of Congo. How prepared are the Nigerian Disease Control Unit, especially in Lagos?
Ebola is not indigenous to Nigeria. In other words, for us to have Ebola outbreak in Nigeria, it has to be imported. And so what we need to do is to step up preparedness at all our borders, land, sea, and air, to ensure that we could quickly identify a probable case, offer additional screening and quarantine so that we do not get Nigerians infected with Ebola.
We're already taking steps. Unlike previously where it seemed like something that was far away, there's a lot of surveillance going on. Our port health has become better equipped to address so that when people who travel, like the last case happened, from history, we've been able to develop tools and infrastructure and strategies to curtail them before they come into the country. We've sensitized our disease control units across the country. The National Disease Control is also very on ground, and they are also making preparations just in case it also comes to Nigeria again, so that we are able to circulate even faster than we did the last time, so that we can have a better outcome. And hopefully, with all of these things in place, we don't have any new case in Nigeria.
Authorities at the Murtala Mohammed Airport in Lagos say they step up health surveillance and vigilance.
So far, we started with the international, but we're spreading it to local flights too. Yeah, we're spreading it to local flights. We have what is called a thermal scanner. We have them at our airports. They're equipped with cameras. You know, the thermal scanners, once you pass through it as a passenger, it takes your temperature. So once we notice the temperature is above 38 degrees, you know, you're pulled aside for further screening. So that's how we're handling it right now. And then I've also been informed that all the pilots and cabin crew of all the international flights, inbound flights, have been notified that once they notice any passenger taken ill during the flight, they should notify, you know, ground, services as soon as they land, so that they separate the passenger and don't allow him to even get into the terminal.
Aside all those preventive measures, what should the average Nigerian do to combat this disease?
Information and education is key in prevention of this disease. We tell the people how to prevent the disease. You have to keep your environment neat, stay away from house rodents, stay away from rats, and also know the symptoms and signs of an Ebola infection. Report to the nearest health center immediately you even suspect. And with this, we should be able to curb the spread.
The regional director of the World Health Organization in Africa, Mutisidu Mueti, said in a statement on Sunday in Abuja that the organization will work with the United Nations and other partners to once again halt the spread of the disease. Oluwatoyin Abo, TVC News. Lagos.
Concerns have been